Hi, everybody. Welcome to our medical talk. Today it's about hair transplantation and all the possible side effects and risks. I would like to welcome Dr. Karoutis from the Swiss Luxury Clinic. Welcome, doctor.
Thank you so much, Peter, for having me. Thank you.
So in an earlier podcast, we have been talking about the techniques and success rates. But of course, there's the dark side, especially in non-qualified surgical surroundings that you have already mentioned, but we'll talk about this again here. And this can lead to side effects and it has some risks. So because we get this question all the time, I thought I'll contact a top-level expert like you, and you let us know about the side effects and the risks.
Okay, so unfortunately, this is a quite common question that individuals have. Usually, side effects in the surgical aspect, which is the hair transplantation, would come from discrepancies, as we said also in the previous meetings we've had, about discrepancies in the execution of the surgery, or focusing a lot on the commercialization and the financial benefits. Of course, some of these side effects usually only come from the way the surgery was executed. Currently, again, as we said, you have a lot of unqualified personnel, which is non-medical, performing these operations. So a very common problem that arises from these operations is permanent damage. So this is why there's also a certain limit when you go to these commercial centers about how many of these operations you have. Of course, taking into consideration that this is a surgery, we take tissue from somewhere and we move it into another area. We have to be quite careful with how we extract it and how much do we extract. Of course, when this is not met, usually you end up with these holes in the back of your head performed by an individual who has no medical background, and they are chasing a number. So they make these holes. These holes are made with sort of a surgical cut that is quite damaging. It's a mechanical trauma with a combination of heat-induced trauma. And this is also why you have long recovery periods. What I would usually navigate my patients, give them as a compass is, of course, ask if a doctor is going to be doing the operation for you, but also how long the recovery is. Always in surgery, a long recovery is because we have a lot of trauma. So this is also how you can kind of navigate and see, is this sort of a nice surgery? What is the recovery time they're giving me? This is sort of the most important thing, because this is permanent damage and this is unfortunately irreversible. So this is the most common side effect.
So basically what you are saying is we have two different types of surgeries. Let's say we have the ones that is done, that are made by professional and well-trained doctors. And then we have the, let's say, as we said in the first podcast, technicians that have no medical background, and they are, they have less skills, let's say. But I mean, the distinction here is clear. But even with, let's say, a highly skilled doctors, I'm assuming there must be some risks and some side effects. And I would like to understand, or just understand, what are the side effects? Is it inflammations? Is it aesthetical issues? What could happen and how do you manage it so it doesn't happen?
Yeah. So, I mean, having enough medical training in surgery and in aesthetic medicine, understanding tissue, you can basically avoid 80% of these issues. The only problem is when this is not happening. So, for example, we could mention sort of an infection that could happen after, but most of the times, if you're taking antibiotics, this should not be there. The other one could be necrosis. But of course, anyone with a medical degree would understand that placing follicles right next to each other, of course, could lead to necrosis if the correct distances is not met. And then, of course, you have the aesthetic problems. So these aesthetic problems on the way this tissue comes out after is something quite common. Again, surgeons usually who go into aesthetic surgery and medicine are very, very careful about how they perform these operations, because they know that their entire credibility is in line here. I think it's worth mentioning a very common side effect that can happen. There's a possibility, is basically the shock loss effect. As I have mentioned in the past, this is a side effect of over harvesting. So you take out a lot of tissue, so then the body goes into a shock state. There is a small chance that we go into the shock state. We have seen it when we take a lot of tissue outside of the body, and then we increase the amount of trauma. Therefore, the individual goes into sort of a shock state, so we end up losing the hair that we already have. Of course, some of this hair is coming back later on, but there is a chance it will never come back. However, side effects are there so that we can avoid them with the execution. Not to say that this is something that can happen, whatever, let's jump into it. So our job as doctors is to make sure that it's as safe as possible and we have as little of these side effects, and then how do we manage them?
Mm-hmm. So to sum it up, knowledge, skills, surgical skills, understanding of tissue, not over harvesting, and of course all the following hygienical procedures will limit risk and side effects to a very little percentage.
Yeah, and specifically, I think the one question which is I always give it as a takeaway message to all the patients, also candidates that are willing to have this, is always ask to speak to a doctor and ask this doctor if he will perform the operation. With these two questions, you can get rid of most of the side effects, and it's the only way to have some sort of safety going forward.
Dr. Karoutis, amazing. Thank you so much for sharing the insights. And
thank you for your time.
It's a pleasure talking to you.
Have a good day.
Thank you. Bye-bye.